Autism Spectrum Disorder by Annabelle Arellano. Definition. To meet the DSM-5 diagnostic criteria for autism or autism spectrum disorder, ASD, the child must have persistent deficits in social communication and interaction in the following three categories. A. Absence of social emotional reciprocity. B. Limited nonverbal communicative behaviors used for social interactions. C. Deficits in understanding, maintaining, and developing social relationships. There is not one type of autism, but is considered a spectrum disorder which affects each individual differently. And the child must have at least two of the four following types of repetitive and restrictive patterns of behaviors. 1. Stereotyped or repetitive motor movements. 2. Insistence on sameness, rigid routines, or ritualized patterns of either nonverbal or verbal behaviors. 3. Fixated, highly restrictive interests that are abnormal in their focus or intensity. And 4. Hyper or hypo-reactivity to sensory input or abnormal interest in sensory aspects of the environment. Absence of social communication and interaction skills, 0 to 15 months of age. These behaviors occur over multiple contexts. Avoids or does not maintain eye contact. Does not respond to name by 9 months of age. Does not show facial expressions such as happy, sad, surprise, etc. Does not play simple interactive games like pat a cake. Uses few or no gestures like waving goodbye, pointing, reaching. Does not share interests to others like showing you an object she likes. Failure to initiate or respond to social interactions. Absence of social communication and interaction skills, 16 to 24 months of age. Does not point to show you something interesting, does not look if you point to something, delayed language skills, does not notice when others are hurt or upset, very few or no meaningful two-word phrases. This does not include imitating or repeating. Still does not respond to name, avoid or resists physical contact. Absence of social communication and interaction skills, 2 to 5 years of age. Does not notice other children or join them in play. Does not pretend to be someone else in play like a teacher or superhero. Does not sing, dance, or act for you, i.e. put on a play. Does not adjust to different social situations, difficulty in making friends, lack of interest in peers or siblings, persistent preference in being alone, appears to be deaf, demonstrates little awareness of danger. For example, will run away, jump off high objects, wander away from parents, caregivers, or teachers. Repetitive and restricted patterns of behavior or interests. These can occur at any age. Lines up toys or other objects and gets upset if objects are disturbed. Flips objects repeatedly. Repeats words and phrases over and over, also called echolalia. Plays with toys the same way every time or is not interested in toys. Gets upset by minor changes, whether in the environment or schedule. Has obsessive interests, like in vehicles, in letters, numbers, certain textures, etc. Is focused on parts of an object, for example, the wheels of a car. Must follow certain routines persistently, flaps hands, rocks body, spins self, plays with fingers, stares into space. Has unusual, intense reactions to the way things sound, smell, taste, look, or feel, aversion to certain textures, especially in foods, needs to take the same route or eat the same foods daily. At any age, the following symptoms may be seen. Delayed motor skills, cognitive or learning skills, hyperactive, impulsive, or inattentive behavior, epilepsy or seizure disorder, unusual eating or sleeping behaviors, gastrointestinal issues like constipation, unusual moods or emotional reactions, anxiety, stress, or excessive worry, lack of fear for safety, loss of previously acquired speech or social skills, difficulty understanding other people's feelings, difficulty with transitions. Diagnosing autism. Some facts. Males are 4 times more likely to have autism than females. Some children with autism appear to develop typically before age 1 or 2 and then plateau or suddenly regress, losing language or social skills they had previously gained. ASD can sometimes be detected at 18 months or younger, but by age 2, a diagnosis by an experienced professional can be considered very reliable. ASD begins before the age of 3 years and can last throughout a person's life, although symptoms may improve over time. Some children show ASD symptoms within the first 12 months of life. Since it is a spectrum disorder, the severity will vary from person to person. For example, some people with ASD may have advanced conversation skills, whereas others may be nonverbal. Some people with ASD need a lot of help in their daily lives. Others can work and live with little to no support. Where to begin as a parent? 1. Set up an appointment with your child's pediatrician to discuss your concerns. Bring your checklist results, see those on the following slide, to your appointment and discuss any other concerns you may have. You know your child best. Your pediatrician may have experience and expertise. However, it may be difficult for them to pick up on developmental issues as they are only observing your child for a short time. If your pediatrician doesn't notice or agree with your concerns, you can ask for a referral for a full developmental assessment. In a situation when a pediatrician will not agree, you can always contact the Illinois Department of Human Services, Family Community Services, or your local school district special education department to request a free developmental screening. Also, in Kankakee County, the Kankakee Area Special Education Cooperative, or KSIC, can give you the names of psychologists that specialize in the diagnosis of ASD. There are links for more resources for parents on the slide. These are the checklists that you can use. Where to begin? Educator. 1. If you suspect a student of yours may have autism spectrum disorder, reach out to the special education department or teacher in your school district. They may be able to help with an informal screening for ASD. Remember, you cannot legally diagnose ASD, and there is no medical test, for example, a blood test, that can determine if a child has it. Number 2, document. You will need unbiased anecdotal notes, pictures, videos, therapist opinions, etc. in order to reinforce your suspicions. Make an appointment or during parent-teacher conferences, present your information to the child's caregiver. They alone can authorize, along with their pediatrician, an evaluation for ASD for their child. Educate parents about ASD so they can understand the information you are presenting and make an informed decision for their child. Below are some resources for school personnel. Links are included. Resources for children. All My Stripes, a story for children with autism. Masterpiece, an inclusive kids book celebrating a child on the autism spectrum. Too Much, an overwhelming day. Davis Speaks, a brother with autism. And Do You Want to Play? Making Friends with an Autistic Kid. These are all picture books for children under the age of 8 and are available on Amazon with links included on the slide.